Hello, my name is Tanae Abel, and in this multimodal podcast, I will be discussing the characteristics of marfan syndrome. Characteristics. The marfan syndrome affects people in different ways. Most people in most cases are very tall with thin arms and legs, and long fingers and toes. Some people have only mild symptoms, while others are more severely affected. In many circumstances, the disorder grows worse with age. The body symptoms most often affected by marfan syndrome are heart and blood, vessels, skeleton, eyes, nervous system, skin, lungs, which can lead to many different symptoms. Less than 10% of people with marfan syndrome aren't faced with any problems associated with the heart and blood vessels. In some cases, a valve between the left chambers of the heart is defective, which leads to an abnormal valve motion when the heart beats. In some cases, the valve may leak, creating a heart murmur. Small leaks may not cause any symptoms. Another body symptom affected is the skeleton, which people are usually very tall or taller than unaffected people in their family, and is slender and loose jointed. The arms and legs, fingers and toes may be very long in comparison to the rest of the body. A person with marfan syndrome often has a long narrow face, and the roof of the mouth may be arched, causing the teeth to be crowned. Other skeletal abnormalities include a sternum or breastbone that is either protruded or indented, flat feet, or a curvature of the spine causing scoliosis. Scoliosis is caused by the very loose ligaments of the spine and the rapid growth of the child with marfan syndrome. About 50% of people with marfan syndrome develop scoliosis, although only about 1/3 of those with scoliosis need treatment. If a child does not show signs of scoliosis by the start of middle school, he or she probably will not develop it later to a significant degree. Scoliosis rarely begins in adulthood. Many people with marfan syndrome are also nearsighted, and some can develop early glaucoma or cataracts. Approximately 65% of people with the disorder have a dislocated lens. Dislocated lenses occur in several other conditions, most commonly after trauma. Cataracts often form in middle age of people with the disorder. Glaucoma will also develop in about 35% of people with the marfan syndrome during their lifetime. Connective tissue provides support for the lens in the eye, and weakness of this and marfan syndrome can lead to the lens moving out of its normal position. This lens dislocation occurs in up to 65% of people with marfan syndrome. The retina is at the back of the inside of the eyeball, and is this part of the eye that receives the light and converts it into an electrical signal that sends it to your brain. The retina can become detached from the back of the inside of the eyeball in people with marfan syndrome due to the weakness of the connective tissue holding it in place. Many of the problems with the lenses in the eye can be compensated for with contact lenses or glasses, but some lens dislocation may need surgery. If a person with marfan syndrome tends to lose or gain weight, they will often form stretch marks on their skin, which are not harmful to one's health and can occur at any stage of life. They tend to appear in areas subject to stress, such as the shoulders, hips, and lower back. Many people with marfan syndrome can also develop an abnormal hernia, where a bulge develops that contains part of the intestines, which, unlike the stretch marks, does require medical treatment. There are many characteristics that were mentioned, some which become visible at different times depending on the person with the marfan syndrome. This syndrome can become very fatal if ignored, so please continue to get routine checkups, stay healthy, and do whatever means necessary to take care of you.